Hello and welcome to Authentic Thriving Podcast. On this episode, I am going to be interviewing another interesting guest. Like I always say, all my guests are so fantastic. So for those of you that don't know me, my name is Sonia, and I am going to just allow my guest to introduce herself. So over to you, Dr. Ebunoluwa.
Okay, hi everyone. My name is Dr. Ebunoluwa. I am a medical doctor and I practice here in the UK at the moment. I had my medical training in Nigeria, then I immigrated to the UK. I'm a specialty doctor in obstetrics and gynaecology, which is why I'm here today.
Okay, fantastic. Thank you very much. So I'm just gonna dive into it because of the time. I don't want to age into your time at all. I just want to dive into it. So the first question I'm gonna ask you is, from your experience as a gynecologist, what are the most problem that you think the most popular problem that you feel that Africans, especially African women, are encountering in the world? I want to say in the UK. I don't want to be limited to the UK.
Okay, I think in the world generally,
Yeah.
if we look at it, well, my responses, let me put that a lot of my responses will be streamlined to obstetrics and gynecology, by the way,
Yes,
but I will
yes.
try to make it as broad as possible. So, some of few things will be actually basic having access to safe care is something that a lot of women out there would have big problem with, especially women from third world countries who have good as problems with access to healthcare.
Mm,
And then the other thing would be even if there is healthcare affordable for countries where healthcare is paid, what's the access like to being able to affordable healthcare? That's
mm,
another bit to look into it. Now we
yeah.
then look like what are we do women get adequate pre-pregnancy counseling, pre-pregnancy care, especially for women that have a lot of other medical conditions. And then we start to talk about what is the maternity care like in pregnancy, what care do our women get? And then also after pregnancy, what's the care like also for these women? And then if we look at the reproductive system in a whole, or the reproductive cycle in a whole, do our women actually get adequate care, especially the ones that have a lot of concerns with their menstrual cycle? A lot of women have painful periods, very heavy periods. How are these being managed for most
Mm,
of these women, getting to a point where it's starting to affect work, starting to affect everyday life? Do they get enough access to care? PCOS is another thing to also mention about how the women getting their diagnoses and how is this being managed also. And
mm,
there's a lot of stigma to bring it out here about women that are experiencing infertility, which is a big issue concerning how this affect the quality. I don't want to say quality of life, but especially for women that really desire to have a baby, how this come off. It's a big impact on them because it come
yes.
off as emotional, mental, and it gets to a point. There may be some impact on their physical life because of all they try to do to achieve this aspect of your life. So
Yeah.
yeah.
Absolutely. So, you've covered quite a lot there. You've talked about the menstrual pain, you've talked about people that have infertility issues. I have interviewed quite a lot of women that have had to go through IVF, to go
Mhm.
through to have their babies and things like that. And you are very right about the stigma that is so common. I don't understand it. While when we have if we have a headache, there is no stigma. If we have a leg pain, there is no stigma. If your if your eye is not clear and you go for glasses, there is no stigma, right? If you're wearing ear aid, there is no stigma. Why is it that when it comes to mental health or when it comes to gynecological issues, there is a lot of stigma attached to it? Would you like to speak to that?
Thank you. I think it stems from a place of a culture. So there's a
Mm,
cultural aspect to the stigma, there's a
yeah,
social aspect to the stigma, and I will say also there's a bit of the basic knowledge gap
yeah,
that probably will
right.
bring up about the stigma. So let's
Mm,
start from mental health. A lot of people just won't be able to understand when some people have some mental health conditions. Before we go into the part with the various, but one of the common ones is depression. And everybody will wonder, like, why are you struggling with this? Why are you struggling with that? Especially coming from a place, because now we're talking about Africa, where I'm so grateful for the fact that we're having a lot of health promotion, a lot of health awareness, and we have a lot of ongoing conversations about these issues now. But a lot
Yes.
of them, culturally, most people are just trained to just deal with it, endure
Mm.
whatever it's going on, just manage it, just get by with it. So a lot of people will have struggled with all of these issues, but then they just kind of suppress it. And now
Mm.
when people come up and things, we're having more awareness about it, and some people still struggle to understand the fact that how can you be depressed? It's just
Mm.
like nothing they can put together.
Mm.
But using the opportunity, I would like to say a lot of these medical conditions are quite they are diagnosed, they are diagnoses, they are confirmed diagnoses, and people actually did suffer from this. And there's a wide range of them. A lot of different people will be on different level of the spectrum. For some people, this clinical conditions is really quite severe. For some
Mm.
people, it may be something that they may still be able to continue their everyday life and just manage easily. Some people
Yes.
will need a lot of support and a lot of medical intervention to be able to manage these conditions and these
Mm-hmm.
diseases. So yes, mental health conditions are quite important, and I'm grateful for the fact that there's a lot of awareness, and gradually I think we are getting better with acceptance of these conditions.
Yes.
The next thing will be the gynecology conditions. For example, you brought up the aspect of infertility.
Yes.
I think coming from an African background where everybody just expects that. Well, there's a timeline to everything. There's a timeline to
Mm.
when you get married. There's a timeline to when you have children. There's a lot of people trying to go through the clock and the cycle and everything with you. And there's this cultural expectation also that comes from the woman. And to put it out there, infertility is actually about the couple. It's not just one person. There is a
Mm.
male factor infertility, there is female factor infertility. So, but most people don't see it this way. Once you don't have children, everybody believes it's the woman.
Mm.
And all of that continues. So that's why I said there's a cultural aspect to it, and there's also a social aspect to it. And I think with conversations like this, opportunities for us to put more information out there, try to
Yeah.
enlighten our people and let them understand, and much more what it means to support people that are actually going through these conditions. For example, again, infertility. It takes a lot. Before these people who come to you, you can imagine a couple, even if they had said that, okay, we want to wait for about 2, 3 years before we start a family, and then they've been trying. For these people, they may not talk about it, but there's a
Mm.
lot of psychological and emotional turmoil going on already. And
Yes.
then people then start to come up, and then the questions will start, oh, what's going on? Why have you not done this? Why have you not done that? It may not be the best way to help these people to manage it because a lot of things around them are already triggers that will
Yes.
bring this to them. So there's a lot of way we need to learn to support people going through this and not just simply assume that everything is all about the female.
Yeah. Thank you so much for adding that to it. It's so important because a lot of people just assume that it's the women. I know that African women have a lot of pain threshold. Like, for example, I know that. Just going to speak for myself that I know that before an African woman will not tell you that I'm in pain. You know that woman is cooked. That woman
Sure.
is in high pain. Do you think this could be the reason why some of the African women's symptoms and pain are often dismissed and not taken seriously in the hospital or here?
I think most times actually, a lot of African women growing up, the way things have just been done, it's just look like a cultural and a social norm. A lot of people are actually raised to just endure pain. And
Mm,
at times, so you just feel like it's a normal thing, and then you
yeah.
just get by to it. That's
Mm,
one. Two, the other factor will be what is actually our approach to healthcare? What's our
mm,
health-seeking behavior like? Most people will kind of probably initially want to self-manage,
yeah.
see how things go, ask friends, ask family, maybe approach somebody with seek pastoral care before we then seek healthcare. There's another
Mm,
bit to it. There's a bit of a notion that African women tend to bear pain better, or they tend to emphasize less, which thankfully is there's a lot of racial differences and cultural differences that will come on a system. So for example, now if you see there's a lot of immigration, global migration and immigration going on now. So you probably will
Yes.
find Africans in European countries and the other way around. So the question is, you will see people who are physically, culturally, and socially trying to navigate two systems at the same time. So they're
Mm.
trying to balance into this new system and work at the same time. You're also trying to, so they're seeking healthcare in a different system.
Yeah.
They're also trying to understand the cultural norms and the social norms of this new system. So
Mm.
at times it may be the fact that they're just not that expressive because they really don't know how to navigate the system.
Yeah.
There will be a bit of cultural barrier, communication, language barrier in some cases. That's also
Yes.
there. And I'm grateful for the fact that we also now have a lot of other people from other nationalities who are also working
Yeah.
in the system here, for example, and
Mm.
also the system also trying to do its very best to actually embrace different cultures. So
Yeah.
in summary, I would say for the patient or for the women taking healthcare, there's a bit of a difference because of the cultural and the social differences.
Mm.
What's our behavior like when we start to seek healthcare? Do we really get to seek the healthcare professional or seek counsel on time, or do we just wait until things are there because before we then seek care? Or the other aspect is you don't have to endure. You don't have to
Mm.
just endure because you've been cultured to endure. Some things you need to escalate and so that you can be helped before things then go down because before things actually depreciate.
Yeah, thank you so much. What do you think is the best way to escalate things? Because for me, if I take myself to the hospital, I take my child to the hospital, right? And the doctor is telling me, oh, don't worry, she doesn't need medication. Let her just rest or sleep it off. I have a way of telling her, can I have a second opinion? Because when my daughter was ill and we called the ambulance, she had bronchitis, but then we're not aware of it. And we called the ambulance. It was the year it snowed heavily in the UK that schools were closed,
Mm,
2012. And we called the ambulance. The ambulance came with a bike. It was that bad. So they had some on the bike. He saw her and he said, oh, she'll be fine. He just spoke to her, she'll be fine. Just make sure she's well covered. I said, she's always covered. He left. And then early hours of the morning, it started again. We called another ambulance. This time it was a mobile one that came with a van.
mm,
And they took her to the hospital. When they saw her in A&E, very before the, let's say about 8 o'clock, they told us to go home, that she's fine, that they've
mm,
seen her, she's fine. She just have a bit of cold and all of this stuff. And we said, okay. By the time I got to church, about 10 or 10:30, a nurse that was in my church said, Sonia, take this child back to the hospital. I was like,
mm,
what do you mean, Sister Grace? He said, you need to take her back. Her neck there is deep in, and her head is bobbing. She can't hold herself properly. He said, that means she's struggling to breathe. So you need to
mm,
take her back to the hospital. So we rushed back to the hospital. Guess what? My doctor. They
mm,
kept her for about 5 to 6 days, and
mm,
they nearly resuscitated her. They had all those things that you guys have on people, on a baby. She was just 6 months old,
mm,
6 months plus old, you know, and they had to syringe her nose several times. They were coming and coming and coming to do that. And then her veins started disappearing before they put those things. So now that kind of land, mine is from experience. It's from
mm,
experience, right? I have to know that no, I have to fight for myself. I have to fight for anybody that is under my care because of
mm,
experience. But what about people that don't have this experience? So now I'm quick to challenge. I will just say, please, can I have a second opinion? So that
mm,
I'll be rest assured that someone else. And most of the time when the second opinion come, is always different. So
mm.
is there other ways that we can do this? Where I don't know, is there other ways that we can do this for people that feel, how do I stand up for myself?
Okay. I'm so sorry about your experience, and I'm glad
Hmm.
that in the end there was a positive outcome.
Yeah,
There are a few
thank you.
things you're welcome. There are a few things I'm gonna pick from your story.
Hmm.
And a few things you did really well, which is something I probably will always advise anybody to do. The first time you called, you felt the child was unwell, so you called, and the
Hmm.
first person came. And then you felt like things were fine. And again, there were still concerns. You
Hmm.
escalated by calling again, and
Yeah.
you had someone else coming, and then you went to A&E. So three things you've done: call the first time, the second call, you went to A&E, And then, yes, you were reassured. And then the other bit was, thankfully, another healthcare professional felt like, no, it seems like things are deteriorating at this point. You need to go back. So those were like the few things, those are like major things to highlight. One, it is good to always seek a second opinion. Even if we see you at work, always remember that if there is a sickness or an illness, a health condition, things can always progress. Things can always deteriorate. And the way the system also works here is there a lot of politics, and there's a lot of policies and protocol about how you manage. There's some situations you can easily manage in the community. You can manage a home safety net, or just say, okay, we can manage on an outpatient basis. There's some cases you will straightforward will admit. So there are a lot of things we always put in between, and we tend to say that for any reason, if you cannot, or if we give you signs to look out for, if you're managing an outpatient basis, and say that we know that things may progress, we started from some of treatment. So you also observe if things are deteriorating or things are progressing and you're noticing this, and this, the next thing to do is to come back. Or you call. So yeah, that's another thing to do, because most time we always say trust your instinct also. So yes, it's good to seek a second opinion. It is also good to, if you're not if you feel that things are different, take a second opinion, reattend if you have to. And then if you feel like maybe you are not being listened to, or maybe you feel like you're not being listened to, or you want a second opinion, you can always ask.
Thank you.
Yeah. And the other thing I was just going to say for every other person would be the fact that at times, a lot of people probably will not actually want to seek, because, for example, here, we know that the way the system is, there's a bit of a waiting time. Oh, I don't want to go to A&E because I have to wait. I don't want to call the GP because I'm not even able to get an appointment, But if you feel something is not right, you need to. There's some things you can get by. A lot of people have barely painful periods and they get by every day. It's getting to a point where things are not bearable, even though there may be concerns, or you'll be like, oh, I don't want to do this, I don't want to make the call, I don't want to have a long wait. But for your own sake, for your own help, you need to, because you need to seek healthcare. So yes, despite all, you need to make that call.
So please, if you're out there, listen to the doctor. Don't gamble with your life. I'm telling you, don't gamble with your life. And don't joke with this like this. Don't gamble with your life. Let people talk. Let them say, this is what we treated you before. I can't be shy for things like that. So please speak up. You need to speak up. It's so important. Thank you so much. There's another point that I wanted to bring. I'll bring this one is 2 in 1. I've noticed something about more people having heavy painful period, right? And my layman's take on this is that when it's close to your period, don't eat sugary things. Lay off the chocolate, lay off the Fanta. Now, I know this is just my very naive way of thinking, but funny enough, it works for me. My mom used to tell me, don't eat sweet things close to your period. Don't drink cocoa and things like that. Lay off the sweet things, and after your period, you can continue, because it makes it heavy and painful. That's one question. Please tell us the possible cause and how to manage and probably even avoid it, because that thing is painful. Then the second one is, I've noticed that thrush cases are very popular now. You see someone is walking, they're itching down there, and it's very, very uncomfortable. And the thrush cream itself is not cheap. They are very tiny kerosene cream. It's very expensive, but the discomfort itself is so embarrassing. You're walking and you're just like, oh God, what do I do? You're shaking. And what is the cause of thrush, and how can we avoid this? Doctor, you're laughing. It's not it's not funny. These things are very, very uncomfortable.
It was just because, as you were saying, I did picture, like, if someone is walking and the person is having itching, and the way you walk and you're trying to hold your thighs together because you're quite uncomfortable and you're itching, I was smiling.
Yeah.
Okay. So 2 big questions you've asked at the same time, and I would try to go I'll go by with them one after the other. So for painful periods, so ideally your period shouldn't be painful, or let me say that painful. So normally your period should be predictable. Oh, I kind of know when I'm coming on my period or I'm coming on my cycle, and I know the number of days it's supposed to last for. That's the most people that have the regular cycle. There are some other people, because of other reasons, that may have a regular cycle. For example, women that have PCOS, or women that are on some form of contraception or hormonal therapy.
Sorry to interrupt you there, Doctor, please. What's the meaning of PCOS? Sorry.
PCOS, polycystic ovarian syndrome.
Okay.
Yes. So some women may have that and they have very regular cycles. Or some women, because of the kind of hormonal contraception they are on, they may have a regular cycle. For example, women that are on the injection or the implants or some of the tablet, they may have. So that's known. Besides that, if everything is fine, most women should have regular cycle. A little bit of pain and discomfort that get better with maybe some home remedies or some simple analgesia is fine. It's understandable. But if you're having a significant amount of pain that is making you miss work, miss school, and the pain is really, really bad, then that is not normal. Then for that, you need to seek healthcare. But if you're having irregular bleeding, you need to seek healthcare. The other thing I don't want us to miss is if you're having every period. Normally, if you have your periods, some people use a tampon, some people use tampon and pad together for hygiene. Some people just use the pads, but most times you keep it on, you can change it every few hours. But if you're having every periods where you're either changing your tampons or your pads every hour, you're passing large amount of clots, your period is lasting longer than 7 days, then that is not usual in quotes. So you need to seek healthcare for us to see what could be causing you to have this significant amount of heavy bleeding. Some people get heavy bleeding such that when they're on their period, they cannot go out because things are that unpredictable. They're going to soak through. They need to change their pads every hour. And some people have to use like adult diapers because of the amount of blood they use. So for that, like Sonia said earlier, please do not gamble with your life. You need to like seek healthcare and don't just be managing such situations at home. You need to speak with your doctor. And if it is needed, you may get a referral to a specialist. So that's for painful periods. Also, if you're having that significant amount of painful period, please remember to speak with your doctor. And then if needed, you will get a referral to a specialist. Now, the second question is thrush. I'm not going to just say thrush. I'm going to say itching. Because there are a lot of other things that can cause itching, not just thrush.
Right.
So if you're having itching, ideally, the first thing we need to talk about is hygiene for most women. Vulval hygiene, vulval care, it's really quite important for every woman. Most times we just tend to say clean with water, clean with simple unscented product, clean with unscented product, that's fine. Change your underwears quite often. Preferably cotton briefs is absolutely fine. For any woman across any age range, if you're having itching, you need to see your healthcare professional for us to check what could be causing the symptoms. You may need to get some assessment. They probably will do some investigations to see if it is thrush, then that can be treated. But then there may be other things causing thrush. They're causing the itching that needs to also be looked into. The other option is if a woman is having recurrent thrush, we need to then look at it. Is there anything on the line that is predisposing this person to be having this recurrent infection? And this may be common in people that have other medical conditions, for example, maybe diabetes, a lot of other things that can reduce their immunity can be causing them to also be having recurrent infections. So that's one thing. And for most people, I tend to say, don't just simply buy over-counter medication because you may be having itching and it's not just thrush. If you're having the itching, there are a lot of other things we will ask you. Are there any rashes also? Are you experiencing any rashes? Are you having any discharge? What kind of discharge is there? Any previous infection? So there are a lot of things to look out for. That you may just be buying the over-counter medication, but actually what you're treating is not thrush.
Right. So it's always very, very important because they also say, is the discharge, is it smelly as well? Is there discoloration in it as well? So these are the things you need to watch out for. Please don't suffer in silence.
And
Just
there's one
go
last thing
and see the doctor.
sorry to cut you. There's one more thing I also want to mention. There's this thing that we tell most women, and you would ask them and you say, do you douche? And they'd be like, oh yeah, when I have my shower, when I have a bath, I just put my fingers in my vagina and I clean it out because that's what makes me feel clean. And for us, no, that's not something we should be doing. The
Huh?
vagina itself is naturally cleansing.
Right.
That is naturally cleansing. And if you think about it, during our menstrual cycle, you will notice that the kind of discharge you have slightly changes from
Yes,
maybe your period. You have your period, then after your period, then around when you ovulate, and then you notice that see the consistency changes. It's just based
that's
on your
true.
cycle. Yes, it is natural. The body has a way of keeping the environment itself. It's supposed to be slightly acidic. So what happens is there are some bacteria that we call the lactobacillus that live in the vagina normally. And what they do is they keep the environment, they keep it in the acidic environment that we're supposed to be. So if you doubt, what you then do is you keep washing off this good bacteria that are there.
Mm.
And then what then
Mm.
happens is you allow a lot of other things to be able to grow there. So that's
Right.
one thing. And
So how do
also
you clean? How do you clean there then?
just clean normally. Wash on the vulva on the outside, and you're done.
That's
It's
it.
fine. Yeah, it
Okay.
naturally cleanses. And most women will also notice your panties over time. You may have like a change of discoloration around the
Mm.
area. Yeah,
Yeah,
it's just based on the acidic component of your vagina and the discharge that you're having. But that's fine. It is if your discharge is increasing,
mm.
it is smelly or you think it's different, the color is different, then you can
Yeah,
have an investigation to see what could be going on. So
right.
please do not doubt if you do that. And the other thing also, when you open your bowels, we tend to say, please clean from front to back, not back to
Mm.
front.
Right.
Because when you open your bowels, also, there are some bacteria that probably will found normally in the feces. And when
Yeah.
you clean from back to front, there's a very tendency that at times you may introduce something from the bowel to the vagina, which you do not want. So we normally say clean from front to back and that. So yes. So
Yeah.
few things about hygiene, vulval care is really, really quite important.
Wow. I think I'm going to have you back, doctor. I know how long it took me to get you to come here. I'm going to be very patient. These are vital informations that I'm sorry, nobody taught me this. I have to find out. You know, in Africa, anything that has to do with sex education, everybody's just
Yeah.
like, oh, they're just dodging it, right?
In some
So,
places, like a taboo, so nobody talks
yeah,
about it, and then you just find out over time. But I think things are changing now.
yeah,
So thank you for the generations that we're having, the new generation of parents. A lot of information is actually online now, so things are
yeah,
gradually evolving. So hopefully
yeah.
things will get better.
Yeah, I hope so. We are heading in the right direction, slowly
Yeah,
but surely, right? There's
100%.
another question I wanted to ask. You
Yep.
know, how often should we change our pads during menstruation?
It's quite subjective because some
Ah,
people will easily just change for hygiene, even if it is not heavy and all, but couple of hours. I don't want to put a timeline to it.
yeah,
4 hours if you can, but if you think your pad's quite soaked, you're feeling soaked, then you need to change
mm,
at that particular point. But we
mm,
tend to say change quite frequently, also quite frequently.
mm,
If 4 to 6 hours, some people may probably, oh, I'm at work, I've don't realize themselves, and it's
yeah,
understandable. But four
yeah,
to six hours, yes. And
okay.
just a message for people that use tampons, we tend to say,
Hmm.
of course, you also change it quite often. You will
Yeah,
have a case when you be like, oh, I'm not sure, um did I remove it? Did I not remove it? If you're not sure, always have a
yeah,
check to be sure if it is not there. Because what we
right,
don't want is a retained tampon.
right,
Because if it is left there for a longer time, it can lead to an infection and environment sepsis, which is
mm,
what we do not want. So if you're not sure if you removed it or not, I know it may feel embarrassing, but it's better to have an examination to have it checked and be sure if it is there or not
yeah.
than
Okay, thank you very much. That type one thing, I don't understand it. It's a bit
it's just
scary for me, and I find it very invasive. Anyway, we'll move on now. A lot of women I've noticed, I don't know if it's the awareness of it, maybe that's why a lot of people think it's happening. This is fibroid. There seems
okay.
to be a lot of cases of fibroid with Black women. Is there something we should know and avoid, or can you please speak to this?
Well, generally, I think genetically, Black women are more predisposed to having fibroids. But
Oh,
generally, most women, fibroids actually happen across all women. It's just that genetically, I think it's been studied to say that Black
yeah.
women are more predisposed to having fibroids.
Mm-hmm.
That's one. If fibroids is there, different symptoms that it can present with. I think one common thing most people will say is they're having very heavy bleeding. And that's one thing that most people will probably mention. Most people may actually have a fibroid and they do not know. I remember in med school, one of the teaching is if you put like 99 women in a room, sorry, if you put 100 women in a room, about 99 of them will have a fibroid, even if it's just a tiny one. Most people
Wow.
may not even know because it's not caused any symptom at all. It's
Yeah.
just sat there. So they may not even know that there is one there. But yes, Black women are a bit more predisposed to having fibroids.
What are the signs that people should watch out for? Because now that's quite high. You know, when you said there's higher chance for Black men to have it, and people don't even know. What are the signs that people should watch out for that will make them think I need to go and see the doctor?
Okay, so generally, I think so I'm going to cover like a few things together. So fibroids, endometriosis, the possibility of adenomyosis. So I would say if your regular period should be about 3 to 7 days. And then you should know the length of your cycle. It's quite a wide range for different people. Some people may have like a 21-day cycle. Some people may say, oh, it's up to about 30, 32, 35 days. But you should have a regular cycle and it should be predictable. If you're having prolonged periods, you're having, first thing is heavy periods, very heavy periods with passage of clots, you're changing your pads every hour, that is not normal.
Right.
Your periods being heavy, lasting longer than 7 days may not be normal. Some people have gotten used to it because that's what has been normal for them for about 10 days or so, but that should not be normal. If maybe you've gotten used to it and you think the symptoms are worsening, you also need to have it checked. So every period, very painful period is not normal. So you also need to have it checked. Painful sexual intercourse is not normal. So you also need to, over time, have that checked also. And then, so every period, so clot, pain, we've talked about. Those are like the common things and pain.
Yeah.
So pain, every period, painful periods, yes, you definitely need to have things checked over
Yeah.
time to see what it be. And the same will also go for women that have irregular periods and there is no cause. It's not as if you are, maybe there's been a classic diagnosis of PCOS. It's not as if that you are on hormonal contraception and you've been informed that you may have irregular periods, irregular bleeds, or you've completely stopped your period because of either an underlying medical condition or a diagnosis. That should also be checked. Yeah, I was going to say something else, but I can't remember. If it comes back, I will say it.
Yes, please. Yes, please. Thank you so much. You mentioned something about painful sexual period. I know there is a name they call that, but I can't
Sparingly.
remember. Okay, I don't know. You are the doctor. Is that a condition that is genetically ingrained, or is there something that should be done to avoid that?
It's not. I'm thinking. I don't think it's genetically ingrained. Painful sexual intercourse. There are different. There are different things that may cause painful sexual intercourse, and we tend to say, okay, the first thing, simple thing is it may be maybe that's the first time the person is having sex and it's quite uncomfortable at that particular time. Any prior history of sexual abuse, because
Right.
mentally that will make things quite difficult. So that's
Yes.
looking at the psychological perspective also. Has there
Mm.
been any woman that has had a female genital mutilation and such that you're having that the vaginal orifice is significantly narrowed that will make sex quite uncomfortable? Is there any other conditions that can also make sex uncomfortable? So we talked about the psychosexual battery rate, but there are also other organic conditions that can also, is any element of infection, is any
Mm.
element of a pelvic infection that is making it quite sore to have sex also there. Is there any endometriosis that can also make sex, especially what we call the deep dyspareunia, make sex also quite uncomfortable. And
Right.
also for some people may have what we call the vulvodynia, that is just the
That's the
vulva
one.
areas.
That is the one I was looking for.
That
Yeah.
is just so painful. Everything
Mm.
is just so painful down there. So that's another thing about that also. I've mentioned infections, right? Yes. Any
Yes.
vulva infections, any pelvic infection that is making sex also quite uncomfortable. And for some people, they may just need a little bit more of getting quite comfortable with sex. Has there been a taboo about sex that is making it very
Mm.
uncomfortable for them to very uncomfortable for them to have sex? Yeah, I remember the last one, virginismus, such that the person want to have sex, but it's just there is this reflex. There is this reflex. They can't control their ability. Once they try to have penetrative sex, their body just naturally clamps up. So it
Right.
makes sex quite uncomfortable also. So vaginismus is another thing. Vulvodynia is another thing.
Mm.
Endometriosis, any pelvic infection that is
Yeah.
causing that. I've mentioned sexual abuse, domestic abuse. These are like the few things we need to always look into to see what could be causing all of these things.
Right. So they will need medical support to be able to explore all of these things that you've mentioned, isn't that right?
Yes, so at times it's always good to see a specialist. You can,
Mm.
if you see your doctor, for example, if you're in the UK, if you speak with your GP, they can always direct you to a specialist if you need to. And in some cases, it actually like a multidisciplinary approach to help
Yeah.
until we get to that point. So at times, some people may just need some element of sexual counseling. Some people may
Yeah.
need more than that. If there's an infection, we get to treat the infection.
Yeah.
So those are like different things that we can do to support. But yes, there's an element of having different form of management.
Wow, doctor, thank you so much. We've got about 5 minutes left, but I have to add this. I have to add this to it, right? They said black women they have higher risk during pregnancy and childbirth. What are the warning signs that a pregnant woman should never ignore? Immediately that sign is there, pack your bag and go to the hospital, irrespective of where you live.
Yeah. So yes, if you look at the different risk and if we look at our so we have maternity reports that comes out every year
Mm.
and then we look at what had happened over the years, what are
Yeah,
things we're doing. And thankfully the system is doing so much to improve outcome for
yeah,
all women, especially women that are probably coming from the disadvantaged groups. So now what are every woman, if you're pregnant, you're not feeling your baby move, reduced movement, you need to call your maternity triage, you need to contact and have a check. That's first thing. Any form of bleeding in pregnancy, you need to have
mm,
an assessment for us to be sure what is going on. Any form of pain, abdominal pain, you need to have an assessment. Always remember that a pregnant person is still a person outside pregnancy. So anything that
mm,
can affect someone that is not pregnant can still affect somebody that is pregnant. So
yeah,
anything that you will be worried about outside pregnancy, you also need to be worried about in pregnancy and have an assessment, speak to somebody, have an assessment if it's needed. Few other medical conditions that will be common when we talk about is high blood pressure in pregnancy. If
mm,
you're having headaches, there are a lot of other things. Headaches that is not getting better with simple rest, paracetamol, you need to have
yeah,
it checked. Any visual disturbances, any blurring of vision, you also need to have it checked also. Getting to have significant swelling of your legs, significant
mm,
swelling of your hands, you need to always have this checked. And also there will be a lot of information out there that your midwives will give. There are a lot of
yeah,
groups now that is really helping Black women out
mm,
there to actually learn more about pregnancy. There's a
yeah,
group called five times more, 5x more. You can find them online, find them on Instagram and Twitter. I think it's a
mm,
very great advocacy group for women and
mm,
it's quite beautiful. There's also an organization called Tummies that actually support women, especially people that have had pregnant miscarriages and pregnancy losses, and it
yeah,
helps them all through to joining pregnancy. There are a lot of these groups out there. I'm
yeah,
trying to remember that the name is not coming, but we'll come back to them. Specific groups for Black women. It's really quite important. I know Tommy's and Five Times More are working together now, and I know Tommy's now has a lot of information out there in
yeah,
different languages for women. Actually,
yeah,
depending on where you come from, that you can always find information to read.
yeah,
Also, there. And also my Royal College of Obstetricians and Gynaecology, we have a lot of patient information leaflets, and at times you can just tweak them to your language if you want to prefer to read a lot of information out there
mm,
in the language. So yes, I would say if there is anything, we take trust your instinct. So
yeah,
anything that we've told you, actually, your specialists, your doctors have told you to look out for, or
mm,
anything you're worried about, speak with somebody. It could be a community midwife. It could ring triage. At times, your triage is not for when I don't. My hospital will call it triage, but other places
mm,
may say maternity assessment unit that you can call. At times, it's not every time that we need to see you in hospital. At times, it
mm,
just give you advice or direct you to what you need to do. So these are
yeah,
the significant things we need to see. And now I know that we've mentioned pregnancy, but
yeah,
remember that we need to cover the antenatal period. We need to
yes,
cover labor itself. And
yeah,
the postpartum period is also quite important.
mm,
Very important for most of our women out there because it looks like everybody just have the baby and everybody just forget about them. No, that
true,
period is
true,
also
true,
quite important
yeah,
because the body's going through a lot, you're
mm,
looking after your baby, your body's healing, and also trying to do all of that, going back to the pre-pregnancy stage. So there are a lot of changes at that particular time going on in their body. And one other thing I also have to say is because a lot of women, based on ethnicity, are predisposed to having diabetes in pregnancy. So what we tend to say is you will have a routine screening. If diabetes in pregnancy comes, the first thing we want to do before medication is lifestyle modifications and dietary changes. Most of
Okay.
our women here struggle with dietary changes because remember that most of our foods are carbohydrate based.
Carbohydrate.
Yeah. So I think that there are a lot of support out there also trying to improve how we can the diets for people from other ethnicities, how we can
Yeah.
improve our advice also for them. So I tend to say, make sure you keep to all your appointments for our pregnant women out there or for our women desiring pregnancies. If you've been trying for a year or more and you've been having regular sexual intercourse, you've not gotten pregnant after a year, please speak to your doctor. If you need to have basic investigations, they will do that. While pregnant, please attend your antenatal classes. There are a lot of support, there are a lot of community groups out there. You will be surprised information you can find. Speak with somebody. A lot of us don't have, the community that we have when you're home.
Yeah.
It's a lot
Yes.
of people struggle
Yes.
because they don't have that here. So at times, wherever you find your community, it could be a church, it could be a religious group, it could just be other people that you can speak to. And a lot of
Yeah.
support now online. You will be surprised. Even your local groups, a lot of mommy groups, you'll be
Yes.
surprised that you have. And even your professions, but people have support for pregnant women out
True.
there. So please feel free to maximize everything that is available to you. And if there's anything, do not keep your mouth shut. Feel free to ask. The worst case is, oh no, everybody tells you everything is fine and you're reassured. But it's better to ask than to keep quiet and then
Yes.
something bad happens.
Absolutely. Thank you so much, Doc. Now I'm coming to you. You've spoken too much. I don't want to recap because everything you've spoken about is just clear. I can understand it. And I really do hope we don't just listen and go, wow, she's really good. Please share and share and share with people and just take on board what she said. Our health is so precious. Let's look after it. Let's not be reactive. Let's be proactive so we can get the help. So now, my doc, you're a very busy person, right? And you guys do a lot of study in your profession. You guys always do one exam or the other. And you've got family and everything. How do you rest?
You learn to manage it, and I think it gets better. If I'm talking for me now, probably we talk about I will
I'm
come
talking, I
from a
want you to talk for
perspective
you, for
of
you, for you. Yeah.
an international medical graduate that then had to like understand and settle into the system. And so how do I rest? So you need to have that understanding about there is me, there is work, and there is
Mm,
a life outside work.
yeah.
And like you highlighted, there are a lot of at times we have a lot of things going on at the same time. You have to write
Mm,
exams and all. And at each point, maybe you have an exams or you have something going on. Yes, the dynamics will change because the demands on you are
yeah.
more. But what you always try to tell ourselves, and even it is part of our core training, is understanding our own well-being, because your well-being is also very important. So,
Yes.
I know when I listen to my body, I know when I need to take a rest. I maximize my leave periods,
Mm,
and at times, rest is not just the fact that I want to sleep. So,
yes.
what do I do? How do I dissociate? How do I look after so I'm going to say my spiritual well-being, my
Mm,
emotional well-being, my mental well-being. I've learned over time to have my own circle of friends and support system that's been very, very good for me.
mm,
Um, I learned to know when things are too much and when I need to take a break. And
yeah.
you also learn to need to understand the system. Oh yeah, I'm going through a phase and maybe I'm preparing for an exam. The demands are more. How can I
Yeah.
maximize it? What supports do I need available for me? And we always need to know when to seek help. There are
Yes.
some things now, like there are some chores. I'm sorry, I outsource because that
Hey,
is the only time
Dr.
I have to
Ebu, I
sleep.
love you. Hey, I love it. That is
There's
so
some
good.
chores that you just outsource. If there's some things you can outsource, outsource. There are things you can delegate. Please, there's no shame in it. Delegate.
Yes. Yes.
There are times you can't. No is a full sentence. If I
Mm.
have to say, I can't take it on, I can't take it on, it's too much. It doesn't mean you're not pushing yourself. You're not being
Yeah.
lazy, but you just need to know, have it clear, understand your strengths, understand your weaknesses,
Mm.
understand things I can do, things I cannot do. no, it's okay. I'm so sorry. I can't take this on board. I can always do something else for you on a later date. That's absolutely fine.
Yeah.
There is, if there is any other personal health condition or challenges, I've said so much, or you do this, you do that also. I need to know to also look after my own health. So I
Yeah.
make sure I do all of that too from the perspective. And whether we like it or not, we are from a community. We also have to make time for our families,
Yeah.
because at the end of the day, we all come back from home, but we all come home. Is home actually a safe space? So we need to do all of that. So that's how I manage all of this.
That is so rich, my daughter. No wonder why you're looking so like a baby girl. You look like a baby girl, right? Nobody will ever know that she's a doctor with all the biz. You guys are always on your feet, moving up and down. Thank you so much, Dr. Ebu.
You're
I just want to
welcome.
say I really appreciate your time, the
Thank you for
sacrifice
having
that
me
you've
too.
made today to be here today. I just know. Thank you so much. I appreciate you. And
You're
on behalf of the
welcome.
audience, I also want to say thank you. All right. Thank
You're
you so
most
much for
welcome.
watching Authentic Thriving Podcast. Until I come your way again, I remain your host, Abisonia. Please do well to keep sharing, liking, subscribing, comment on what stood out for you. Join the conversation. Want to hear from you as well. Until I come your way again, I will say goodbye and God bless.